Hello, welcome back to my channel. If you are new here, hi, my name is Irene Parklin. I hope you enjoyed this video and stay well. Now, in my last video, I talked about 10 non-bedside nursing positions, and in this video, I will be going through the 10 of them, as well as giving you descriptions and answering some questions that I got in my previous video and letting you know about the salary that I get paid. Now, the first non-bedside nursing position that I gave is as a nurse case manager. Basically, nurse case managers focuses on nursing duties such as assessment, planning, implementing these plans, and evaluating the care needs of a designated group of patients. Okay, so this is where I have a lot more information because I currently work as a nurse case manager and I work from home. And I would say this job is amazing. It offers flexibility, it offers the work-life balance we all talk about that we want. This job is 10 out of 10. How I got into this job, I was able to acquire this after working as an AFC nurse case manager. So basically, the AFC nurse manager role prepared me to work here as a case manager. So I currently work with the insurance, and part of what they require, I had already begun with the previous job, if that makes sense. So technically, this job requires some sort of experience, but not necessarily bedside med-surg kind of experience. It mostly requires documentations regarding some assessments that need to get done. So I would just like to say working as an AFC nurse prepared me for this. And if I had named my previous video 11 non-bedside nursing positions, being an AFC nurse is one of them, okay? I can also go into that about that. But yes, that is my number one non-bedside nursing job description. And full reveal, when I started with them, my base pay, and this is coming to you with no experience working with insurance, mind you. I only worked AFC nurse where it was a hybrid position as well. So 70% at home in your office, and then 30% you are required to go see the patients in their homes and perform your assessments. Now, these are not hands-on assessments. You are just asking questions to see if they require any services at home. So yeah, that's basically it. And the base pay, like I said, was $95 to start, and that was a minute ago. But the average salary range here in Massachusetts is between 95 to 105 US dollars. 105,000 US dollars. And my next non-bedside nursing position is the nurse consultant. I'm just going to read you what I wrote right here. A nurse consultant provide individualized services to people facing challenges associated with developmental disabilities, mental illness throughout a region. So in this job, in this nursing role, the nurse consultants train staff. They train them on things about vital sign and blood glucose management, providing on-call consultations. And it's technically like what I do, but the name is just different. It's a nurse consultant compared to being a nurse case manager. And you work in this role as a patient advocate because these populations can't make 100% decisions by themselves. So your job is to advocate, to assist in developing goals, to achieve independence and improved quality of life. So with the salary range on this job, I know for a fact that they offer, it's kind of what they offered me as a nurse case manager. I have a friend that actually works here, and to respond to a question that I had that I got in my previous video, they offered her right out of nursing school, mind you. She's never worked as a nurse before. She just passed her boards and she applied to this position. So they offered her the job, and I believe her starting was 97,000 US dollars. 97K. But anyway, that was what was offered to her. So it can go between 97 and 100, like in the early 100 grand. And most of these jobs also come with bonuses. So when you combine everything together, you're technically receiving 6 figures right out of nursing school. So I do remember that when she was interviewing for this position, straight out of nursing school, she went there. You know, there were a lot of other nurses interviewing as well. However, it was a no-brainer because one of their requirements was for the nurse to have experience working with developmental services. Now, this doesn't mean you have to be a nurse. When I was in nursing school, I worked as a nurse assistant while I attended nursing school. So I had some experience working in that field. You get what I'm saying? So she, as my friend, she worked while we were both in nursing school. We attended nursing school together. She worked as a residential counselor for one of these developmental service homes. And that was already in her background. So what separated her from the other nurses with like 7 years of nursing experience and so forth was the fact that she had these in her background. So if you are out there, a nursing student, you like case management, you feel like bedside is not for you, and you want to do something outpatient, you know, as a nurse consultant or a nurse case manager, it's possible to get this kind of job right out of nursing school. They might require a little bit of experience, but it's not crazy like, oh, you have to be certified in like critical care or whatever. Like, no, you just have to have some experience working with this population, so the transition would not be too crazy, you know? But yeah, so number 3 that I have here is aesthetic nursing. So aesthetic nursing, they work outpatient as well. The aesthetic nurse work at a medical spa. They focus on patients' satisfaction, technically. They do non-surgical facial rejuvenations, such as Botox and fillers. They usually require certification in neurotoxin, injectables, derma fillers, and neuromodulators. Now, these nurses test patients and recommend treatment regimens for them. Like when you get a patient come to you in the outpatient setting in the med spa, they usually like assess them for like, and some patients need like facial balancing. So the nurses assess them, determine how many units of, say, Botox or fillers they need to inject on one part of the face as opposed to the other part. So currently I don't have any friends that work as an aesthetic nurse. So I don't know about how much specifically they earn, but when I was trying to figure out my path working outpatient, I considered working as an aesthetic nurse because there was a time I wanted to become a CRNA and to focus in like the surgical, like the aesthetic part of it. So I was considering maybe doing this path and leading up from there. But anyway, the salary range is between $45 to $50 per hour. So it is not a salaried position. The previous one, nurse case manager as well as nurse consultant, are both salaried positions. So number 4 is as an MDS nurse. So I'm gonna read what I wrote here and read to you what I know about. Now, an MDS assessment, first of all, is a comprehensive assessment of the client's health status and care needs. So the nurses provide annual assessment for recertification that helps determine the level of care and services the client requires. So it's crazy because I'm like, I have a lot to talk about regarding outpatient nursing and this. Most people don't know about these whole job requirements. So When I left bedside nursing, I got a job as an AFC nurse, and that is an adult foster care nurse, where these patients in their homes, we call them members, they get taken care of by a family member, a loved one. It could be a friend as well. But it's mostly required that the person that is taking care of these patients reside together. So anyway, part of my job as an RN working with the adult foster health nurse company was to perform MDS assessments. So annually I had to do these assessments with these members to figure out what services they qualify for, in the community, if they need this, or to figure out if they still qualify to be in the AFC service. So when I left and working as an AFC nurse, I got my job as a nurse case manager working with the insurance company. So the insurance company also does MDS assessments. And till today, I do annual assessments for members. So you see them once a year, you perform this assessment, you enter the form, like document when you get back to your office, and that form technically determines the services that they qualify for, or what services that you as a nurse need to recommend to these members. So apart from working as an AFC nurse and as a nurse case manager, where you get to do this assessment, there is actually a job description requiring an MDS nurse. Like, you just go out there, your job is just to perform MDS assessments. Now they do have these job positions inpatient, but we're not talking inpatient here. We're only talking outpatient nursing. So this working as an MDS nurse is an amazing thing to be. You're just going out, seeing the patient, performing your assessment and documenting. And in this job position, the pay that I usually see out there is between $85,000 and $100,000. Now, they might differ. Some place pays more than that, but that just gives you the range where you get to like bargain for. It is usually a salaried position when you're working outpatient, but in the hospital or a long-term care facility that needs an MDS nurse, they usually pay per hour. But it is still flexible. It still offers that flexibility because mostly you're working from home and you're just going out like a couple of days a week to see these members according to the time that you have available, because mostly we schedule our visits with these members. Now on to the next one. Number 5 is working as an urgent care nurse. I know a lot of people know about working as an urgent care nurse. So most hospitals, they do have urgent care units where patient needs some vaccinations, they need some blood draws. They can just walk in and see a practitioner. So I'm going to read to you what I wrote concerning this. The urgent care RN supervises medical assistants, assesses vital signs, clean wounds, perform dressing changes, administer oral or injectable medications, and vaccines. So they provide health teaching as well to patients and family regarding or related to their clinical conditions. So that's basically their job descriptions. So each facility differ, they might have more, but it's pretty much to the point. You go there Monday to Friday, you work your hours, and you're done at the end of the day. And their salary is usually between $40 to $50 per hour. It is not a salaried position. But yeah, it is pretty flexible. If you want to feel like you're working in a hospital, but you only get to work, say, 8 hours every week, like 9 to 5 or like 8 to 4, this is the kind of job you should be looking into and you should apply to. Like, you are still a nurse at the end of the day. You still passed your boards. You went to nursing school. What are we talking about here? All right. Just for a quick note, I will be splitting this video into 2 sessions where I get to talk about the first 5, and then in session B, I will talk about the other 5 bedside nursing positions. I hope you can stick through and you're able to learn from my video. All right, let's get into it.